we have to have robust testing of the general public.
The more we can do testing, the more we can get people confidence up, the more places like the airports and the airlines are going to be able to come back.
Testing is the single most important topic for us to understand, I think. Testing is how you monitor the rate of infection and you control for it. And that is the whole tension in reopening.
A series of governors talking about the importance of testing in this for COVID as we escalate our response here in the United States. And we're joined now by the Coronavirus Response Coordinator from the White House, Dr. Deborah Birx. Dr. Birx, thank you for joining us this morning. We just heard those governors talk about the importance of testing right there. The president said it's going very, very well at his press conference yesterday, but researchers with the COVID testing project up at Harvard has said that we need to triple the daily amount of testing in the United States in order to get us on a path towards reopening in May, more like 500 to 700,000 a day rather than about 150,000 a day. Are they right, and what's it going to take to get there?
Well, thank you, and good morning. So I think there's three aspects of how to monitor the spread of COVID. And I understand one of those critical legs in the stool is testing. But the other two legs are really making sure that we're monitoring using our syndromic and our influenza-like illness. It's up on the CDC website. Every state has that capacity. And making sure that they're monitoring those two elements at the same time that we're expanding testing. Because I want to be very clear to the American people, none of our tests are 100% sensitive and specific. What do I mean by that? None of our tests that we use in medicine can diagnose 100% of the people who are positive and correctly diagnose 100% of the people who are negative. These are very good tests, but if you utilize them in what we call very low prevalence states where there's no evidence of COVID-19, you can both have false negatives and false positives. So we're working with every governor and every mayor and frankly every laboratory to ensure that we have quality tests out there and also to ensure that we're meeting with the government and with the governors the needs that they have in each of those labs. And so the solutions need to be tailored to each of the issues that each of the labs may have.
But what the governors are saying, though, is that we need national coordination of that entire effort to make sure the supplies are getting where they need.
So first, I just want to remind everyone that 4 weeks ago, we were working off of the pandemic platform that had been developed for pandemic flus. And we realized, and the president realized, that we had to change completely how we were doing testing. And that's why we brought in the diagnostic companies that really work on novel tests and brought in the large commercial labs. And I think you could see from the diagrams yesterday that almost 60% of the tests to date have been done by these large commercial labs. But we've also put out an additional 7 platforms for additional tests to make it possible for hospitals to test and clinics to test. And I think what we don't have right now is complete reporting. So when you look at the number of cases that have been diagnosed, you realize that there's probably 30 to 50,000 additional tests that are being done that are being reported right now. But we also understand that there have been specific issues at specific labs. And to find those solutions, you've got to do it in a granular, fact-based, data-driven way. So we have a team calling every single laboratory that has all these platforms throughout the United States. There's over thousands of them and over 300 labs, and they're calling every one to work with each state and local authority to ensure that they have everything that they need to turn on full capacity, which will, we believe, double the number of tests that are available for Americans.
Is that going to be enough to prevent a second wave?
Well, that's a very interesting question because we've never had a pandemic like this before. So we believe it's been enough in a whole series of the outbreak areas. When you see how Detroit has been able to test Louisiana, Rhode Island, New York, and New Jersey, we preferentially put these tests where the outbreaks were so that people could be diagnosed, because the number one issue that the president wanted us to address is to make sure we were saving all the lives. So he wanted to make sure that everyone who was sick had a test, and everyone who was sick that needed a hospital bed got a hospital bed, and everyone that needed a ventilator got a ventilator. And now we're working on expanding testing strategy across the United States, but in deep partnerships with governors, and more importantly, in partnership with the lab directors who actually know precisely what the issues are that need to be solved.
The president has suspended funding for the World Health Organization and blamed them for covering up the spread of the virus. But more than a dozen U.S. officials have been embedded at the WHO since this crisis began. Since December 31st, there were constant briefings with senior officials, so they were getting the same information in real time from the WHO. So is it fair to blame the WHO for covering up the spread of this virus?
You know, I think early on, when you go back to and again, I watch epidemics around the world, and the level of transparency and communication that you need, you have to over-communicate. You have to communicate even the small nuances. You know, when you look at the outbreak that's been reported in China, and you look at the outbreak that was able to be contained in South Korea and a series of Asian countries, you didn't see that kind of doubling rate. You didn't see that logarithmic increase that you see all throughout the developed countries of Europe and certainly in the United States. And so when you look at those countries, it wasn't until the beginning of March that we could all fully see how contagious this virus was, how transmittable it was. And I think that level between January, when we had evidence of this apparently, and when we really understood its level of transmissibility, it's always the first country that gets exposed to the pandemic that has really a higher moral obligation on communicating and transparency, because all the other countries around the world are making decisions on that. And that's something we can look into after this is over. I know the European countries are communicating very effectively with each other and with us. And when we get through this as a global community, we can figure out really what has to happen for first alerts and transparency and understanding very early on about how this virus and how incredibly contagious this virus is.
Finally, we're seeing protests crop up in states across the country now against these stay-at-home restrictions, including in Austin, Texas yesterday. I want to show some of that right here, where you hear the protesters saying, "Fire Fauci, fire Fauci." And you're also hearing from these people that they're not worried about the virus, that they think they're going to be able to develop immunity. What is your message to these protesters out there right now?
Well, first, Dr. Fauci and I have had a strong partnership for over 30+ years, and we've been telling the American people all along that they need to really follow state and local guidelines, and they themselves need to be educated and knowledgeable about this virus. We're not only protecting ourselves, but we're protecting each other when we follow the guidelines. That said, every state needs to really do a great job of communicating in local communities, because we know every community is different. I'd like every American today to go to the Florida public health site, because I had a question yesterday about a specific county in Florida, and I wanted to go in and investigate. And because these outbreaks are very local, the data needs to be analyzed locally. And so we all should look at the Florida public health site. I think they're doing an extraordinary job keeping their communities informed day by day about where the virus is, where the new cases are. It's divided by county and zip code. They talk about where the testing is available, but they show in a very transparent way all the cases. And I think bringing knowledge to the community is what is going to be critical in ensuring that we get not only through this phase, but the other 3 phases, and prevent a future outbreak if the virus comes back in the fall.
Dr. Birx, thanks for your time this morning.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.